Before starting the video, I would just like to draw your attention to the most serious threat to the world, which the UN and the top scientists are predicting. Our Mother Earth is the source of everything that we need in our lives. Presently, she is passing through a very tough phase of ill health. This is all due to our irresponsible way of living. In next 30 to 40 years, due to the lack of organic content, the capacity of the Mother Earth to produce food will be reduced to an extent that our coming generation will not get sufficient and quality food. Global environment will also be having many catastrophic events. So we all need to live more consciously. To know more, log into the given website and be a part of Save Soil campaign. Dear friends, Namaskar. I am Dr. Anil Taneja. Today I will be talking on what is blood pressure, what are the symptoms, and what are the factors that cause it and also that increase the blood pressure. About 40% of the world's adult population is suffering from blood pressure. That means 4 persons in every 10 persons are suffering from it. There are two components of blood pressure, systolic and diastolic. Systolic is the upper blood pressure, diastolic is the lower blood pressure. There are few contradictions between the American, European and other guidelines. In India, we take 130 by 80 as normal blood pressure and more than 140 by 90 we take as increased blood pressure. The blood pressure range between 130 by 80 to 140 by 90 is called as elevated blood pressure, and such patients, they are called as prehypertensives. These prehypertensive patients usually develop into frank hypertension as the age advances if they don't take precautions. So we should keep on monitoring our blood pressure frequently. Symptoms of blood pressure. Most of the patients never develop any symptom. Slowly and slowly it is causing damage to our organs, and many times the patient straightway lands into the emergency, maybe with heart attack, brain attack, stroke, nasal bleed or kidney failure or anything like that. That is why it is also called as a silent killer. The common symptoms seen are headache or heaviness in the head, which is usually more so in the morning, dizziness, lack of sleep, flushing, sweating, chest pain, breathlessness, restlessness, nasal bleed, blurring in the vision, and sometimes chronic fatigue. Causes of blood pressure. Hypertension is divided into two categories, primary and secondary. Primary hypertension is when there is no clear-cut cause. The secondary hypertension is when you can ascertain the cause. More than 90% of the cases, they belong to primary hypertension. There are certain factors which predispose the person to develop hypertension, and also they increase the blood pressure. Number one is obesity or overweight. Obese people are more prone to develop hypertension. Obesity can be measured by seeing the BMI chart, body mass index chart. The normal range is 19 to 25, 25 to 30 is overweight, and more than 30 is obesity. Similarly, this can also be measured by measuring the waist circumference, which in male if more than 94 centimeters is obese, and in females it should be less than 80 centimeters normally. Number 2 is heredity or familial. When parents or other siblings of the family they are having hypertension, there are chances to develop hypertension. Number 3 is increasing age. As the age advances, the blood pressure also increases. By the age of 60 or more than 50% of the population develops hypertension. It is more so in the ladies. Number 4 is sedentary lifestyle. This also predisposes a person to develop hypertension. Number 5 is increased intake of salt. In persons who consume lot of salts in their diet and take more of those things which contain excessive salt like pickles, chutneys, snacks, etc., they are more prone to develop hypertension. Number 6 is faulty food and eating habits. Excessive consumption of refined foods, fast foods, processed foods, high fat dairy products, they all lead to increased blood pressure. These are called inflammatory diets. They are the root cause of many other diseases also. Ayurveda and yogic pathy had always been condemning these diets since centuries. Now the medical science is also saying the same thing. Number 7 is smoking. Number 8 is alcohol. Smoking and alcohol both increase blood pressure. Number 9 is dyslipidemia. That means the increased level of lipids in our blood. They also predispose to hypertension. Number 10 is irregular sleeping habits and improper sleep. Number 11 is excess stress, strain, anxiety, anger or aggressive behavior, and type A personality. These are all predisposing factors to cause blood pressure. Number 12 is pregnancy. It has been seen that 7 to 10% of the pregnant ladies, they develop hypertension. Number 13 is certain drugs. They also cause, if taken for a longer time, they also cause blood pressure. Like painkillers, when taken for a long time, maybe ibuprofen, naproxen, etc. Similarly, antidepressants like venlafaxine, duloxetine, etc. When taken for longer periods, they can cause hypertension. Secondary hypertension. In about less than 10% of the cases, it is secondary hypertension to some other disease. It may be some kidney disease, maybe some old infection, maybe some renal artery stenosis or some tumor in the kidney. Similarly, it may be some thyroid disease like hypothyroid or hyperthyroid. It may be some parathyroid disease. It may be some adrenal gland disease, etc. There are so many other causes also. In my next talk, I will be talking on how to treat a case of hypertension without medicines. If you have any questions, any suggestions, or you want to share your experience, please do write in comment box or at the given email ID. If you find this information useful, you can like or share the video, and if you want to receive more such like videos, you can subscribe the channel also. May God bless everybody. Thanks for watching.